Welcome back. Those who rely on Medicare or perhaps the marketplace for health insurance, you'll want to listen up. There are some changes coming in 2025, but fear not, there are specialists to help you navigate it all. And I'm here now with one of them. We have Macy Mishler here. She's CEO and advisor of Rural Health Advisors, which is now has a Grand Island location.
Yes.
So thank you for being here.
Yeah, thank you.
Okay, so talking about enrollment that's coming up in 2025, there are people that might not have coverage, or people, that do have Medicare, and so there's things to be thinking about, right?
Right, absolutely. So one of the biggest changes that we're going to see in 2025 is to prescription drugs. So that's your Part D plan of Medicare, and there's new laws and regulations. So we are looking forward to that, and we're anticipating one of the busiest fall enrollment seasons to date.
Wow. When does enrollment season officially kick off?
So we can see plans starting October 1st, but we can start enrollments October 15th, and that runs through December 7th.
So when people come in, what are the questions that they have? What kind of knowledge will they gain from you when they come and get some help?
So our office specializes in Medicare. So this is what we do every single day. And right now what our office is doing is training for this fall and for the plans that are coming next year. Mm-hmm. When you walk into our office, we start with information first. So our goal is always to help you find what you need, right? Instead of what works best for your neighbor, which may not work best for you. Right. So we ask for information like your prescription drug list, your doctor's list. We take into consideration what coverage you have right now, and then we build out a plan to meet your specific needs.
Okay. When it comes to Medicare, who are those that are eligible for Medicare?
So typically people over the age of 65 are eligible for Medicare. It depends on whether they have employer coverage or what their current coverage looks like, whether we want to start on Medicare fully or whether we want to wait and stay on that employer. Mm-hmm. Otherwise, we also have folks who have been on disability can also qualify for Medicare.
Okay, gotcha. And like you said, maybe every year some things start changing, so it can be hard to navigate or understand some of the terminology. It can just kind of go over people's heads. So you guys are specialized in this sort of thing and can help them kind of go through it. Is there anything in particular that they would need to bring in with them if they were to come in and have an appointment?
So typically we like them to bring that prescription list or any doctors that they need to see. They're going to want to bring in their current coverage card because we need to know what they've got. Sure. And then their Medicare card.
Okay, very nice. If people would like to get in touch, need more information, what's the best way to reach out? Because like I mentioned, now there is a location in Grand Island.
Yes, absolutely. And we do travel a little bit. So if you aren't able to get to Grand Island, we can usually come to you. And our office, typically you want to give us a call. That's the easiest thing to do. And we will put you on the list and start working through everything with you individually.
Okay, perfect. Well, Macy here with Rural Healthcare Providers. Thank you so much.
Yeah, absolutely.
All right, and stick with us. We have your forecast coming up next.